we've talked to a number of others who've had a role in the college in the past, and I've always started by asking them what drew them to family medicine in the first place, what drew them to certification, just how they, why not a specialist, Cal?
Well, it's a very good question. It's a relevant question now. It was really relevant at the time that I was in medical school and graduated from medical school. Throughout my medical school experience, which I still think of as a great positive experience at the University of Manitoba, we really had no exposure to general practice or family medicine. We knew that there were family doctor GPs in the community. As a matter of fact, many of our families at that time, and when we were growing up in town, didn't have a family doctor. There was a lot of primary care delivered by specialists. So my sister and I basically had a pediatrician that took care of us up to a certain age. My parents had an internist. I knew several of my friends who had a family doctor, but there didn't seem to be somebody in our neighborhood who filled that role. And it was not part of the curriculum for me as and for us as medical students. I basically then, after I graduated from medical school, I did about 6 months of practice after a rotating internship in Winnipeg, which was an excellent experience as well. And I went to Lake of the Woods in Kenora and worked there with the group in Lake of the Woods, who were a fabulous group of people. And the physicians who were the core part of that group were used to the fact that there would be new graduates coming in who had core knowledge and skills but needed help, and they helped us a lot. But we did have a pretty good base to work from. We had anesthesia skills, some minor surgical and minor intraoperative surgical skills, and a broad base of other skills, but not learned within a context of a discipline, just in terms of doing different rotations. But these general practitioners were fabulous in terms of what they taught us and that they supervised us with, and within a matter of weeks we had picked up other skills. So I had a really good experience there, and I had my first real exposure to the general practitioner, and a general practitioner in a rural kind of setting, although there were referrals from other small towns and First Nations communities in the area that we both visited and that came in. It was exciting. But I still had not, and I knew I wanted to go back for postgraduate training, and I'd applied at the University of Toronto, and I was accepted into internal medicine, and I did do that. I did 2 years of internal medicine, and I loved every single experience I had, from one specialty to the next. And the Department of Family Medicine had been started at the University of Toronto about a year or so, maybe 2 years before I actually was doing my internal medicine. And I was at the Toronto Western Hospital, where there was a really excellent, dynamic group of family physicians who had started that department, led by Reg Perkin and many others, who I got to know as a medical resident. And as I got into my second year, I was like my peer residents, I was being asked what subspecialty I would like to go into or carry on in general internal medicine. And I had had a lot of opportunity to interact with this new Department of Family Medicine and the physicians within it and some of the few residents that they had. And actually the chief of the department, the head of the Department of Medicine, sat down with me and said, you know, you've done well in all of the subspecialty areas you've been in. You could pick whatever you want, and I think you'd be able to be accepted. But it sounds as though you might actually benefit by, because I was talking about an option being I would take a year off, and I would just go into practice and I'd see what that would be like, because I knew I enjoyed so much the interaction with patients, the people, the patient-doctor relationship, and being able to deal with different problems, all ages, all problems that present. And he actually said, I'm going to take you over to the Department of Family Medicine and formally introduce you to them, and maybe they could actually find a role for you even during this year that you would have a look at, and then you can decide which subspecialty you want. Well, that was the door opener, and basically I, for the next year, had a few half days at the family practice unit. I linked up with a community-based practice and did some days of the week there. And a major thing was that they had no supervising physicians in the emergency department. And according to the chief of medicine, He thought that I had a natural liking for the eMERGE work, and he was pleased with what I had done in that area, and he said, we would like to actually have you act as a senior resident, junior staff person supervising in the eMERGE, because we don't have a department that takes responsibility for it. And I think that was arranged through the Department of Family Medicine that I started to do that. Well, I loved that year. And that, I knew I wasn't going to go back after that, and I then set up a practice of my own, continued at the family practice teaching unit at the Toronto Western for 2 to 3 half days a week. And we established a department in the emergency department. Family medicine more formally took over, and I was one of the people who was helping to organize the emergency department from a faculty level. And we eventually developed really one of the first, if not the first, emergency medicine residency program in family medicine a number of years down the road, which I had the privilege of being the director for. But the pieces all started to fall together, and the joy of being able to have a continuing relationship with patients, providing comprehensive care, but also having the opportunity to actually also practice and focus for different periods of time during the week on other special interests that I had, in emergency medicine being the top one at that time, and then I developed an interest in sport medicine, and I did that as part of my practice. Started off fulfilling and remained fulfilling for the rest of my career.